Outstanding night, I promise you that. The other promise we've made in the past when we all come together, that we will end at 9 o'clock. Because I know it's one more dinner, but I will tell you this. First, is it not outstanding that we are physically here all together? I'm watching everybody. You all are a bunch of liars. You've lost weight. You look good. You don't even remember us. Well, that being said, we also are live streaming. So for those that are unable to be here but are watching and contributing, we want to thank you for being a part of this, and we hope you enjoy it as much as us. Today, as we pick this venue, could you have a nicer venue than the Institute of Peace? This is stunning. And I think it's only fitting that the Alliance holds its gala here because we have so many people to recognize and acknowledge and really to be so proud of making a difference so we secure healthy aging. But I want to start off really with positive news. And that is the first exciting announcement we have here is to let you know that based upon your Alliance efforts that have all of you collectively paid and contributed, and to our sponsors, last year we had $525,000 raised. This year, do you think we beat 525?
Easy.
How about 575? We have over $100,000 more than last year, exceeding $620,000 for the Alliance. Is that not? So thank you sincerely for your generosity and all that you do for those that contributed, for those who provide in-kind services, for those that help us with our cause and getting the voice out. To each and every one of you, you have made a significant difference this year, and this is what we're going to celebrate. So we know that there's a lot of incredible causes, and you're pulled in a million directions, but it means the world for us to have you here today with your generous contributions of time and talent. And we also wanted to recognize and talk a little bit about the Alliance mission, which is to accelerate the pace of scientific discoveries and their application to improve the universal human experience of aging and health. The Alliance vision is a culture that respects aging as a greater good and values investments that advance independence, dignity, and equity. And that's what it's all about for the Alliance. So speaking of which, we're going to now turn our attention to the screen behind me to get a glimpse of the past year of the Alliance while you enjoy your salads. And for those that are watching it streaming, you will see it, but there won't be a sound for a few minutes. So here, let's watch the video. That was very good. So now it's my pleasure to introduce to you the inspirational, dynamic President and CEO of the Alliance for Aging Research, Ms. Sue Peshin.
Okay, woo, thank you. Okay, thank you, Kevin. I know I'm not the only one who thinks you're awesome. It is wonderful to have your uplifting energy here back with us in person. Now, for the rest of you, please raise your glass of bubbly or whatever wets your whistle. And those of you at home, please join us. Hi, Mom. On behalf of the Alliance for Aging Research team, here is to all of you. It means a lot to us to have you here this evening, and my dad is actually here this evening. And my stepmom and my kids as well, so come over and say hi. Thank you and cheers. Okay, I have an important list of thank yous, so I appreciate you joining me in acknowledging everyone. I first want to thank Jim Scott, who chairs our board of directors and serves as our 2022 dinner committee chair, as well as our dinner committee, for their input in helping us shape this event and for introducing us to some new friends who are joining us for the first time. Our entire board of directors supports us and our mission in countless ways and serves as our guiding light. In addition to Jim Scott, we're fortunate to have many board members here with us tonight and also joining us on the live stream. I'm going to ask those in the room to please stand and ask all of you to join me in acknowledging them. This evening would simply not be possible without the kind support of our sponsors. Please join me in applauding them at the end. Our award underwriters include the Claude Pepper Foundation, sponsoring the Claude Pepper Award for Advancing Healthy Aging, Eli Lilly, supporter of the Distinguished Public Service Award, AdvaMed, supporter of the Silver Innovator Award, and Johnson & Johnson, supporter of our Perennial Hero Award. Our gold sponsors include Biogen and GlaxoSmithKline. Our silver sponsors include Acadia and Bristol-Myers Squibb. And our 2022 bronze level dinner sponsors are AbbVie, Bio, Lundbeck, Neurocrine Biosciences, Penn Quarter Partners, PWR, Prevent Blindness, USP, and George Vredenberg. Additionally, we thank our fabulous CMS and FDA roundtable sponsors, Eisai, Gilead, Merck, Otsuka, and United Health Group. Our roundtable supporters, Abbott, Applied Policy, Bright Focus Foundation, Dexcom, Genentech, and Pharma, and our roundtable innovators, Avenir, Better Medicare Alliance, Chippa, Cytokinetics, Healthy Women, King & Spalding, National Pharmaceutical Council, Omnicom Health Group, Pfizer, PCMA, Cirrus Therapeutics, Venable, and Women Heart. Thank you also to Bobby Koch, President and CEO of the Wine Institute, for donating tonight's delicious Chardonnay. I also want to thank David Farber and Priya Pinto at King & Spalding for their wise counsel in our advocacy work for Medicare coverage and access to FDA-approved medical treatments. And I'm wrapping up our respected list of our sponsors and supporters this year with a surprise award for someone that has given so much to the Alliance. The Alliance has been a pro bono client of Aiken Gumps for several years, and we have referred to them as our special superpower. I've been fortunate to know one of their senior advisors, Todd Tootin, since 2007. Todd has been my champion, guide, and friend. Over the years, he has given me numerous crash courses in health policy, told me when I should push and when I probably needed to take it down a notch, Guess which one he had to do more of? And he showed up generously with charm and enthusiasm. Todd is retiring this December, and I invite him, don't worry, no speech required, to come up to accept the 2022 Alliance for Aging Research Superpower Award. Okay, our event themes for 2022 are generative, oh my goodness, I can't even say it. Our event themes for 2022 are generativity, joy, and healthy aging. We chose generativity because we think you've graduated to an SAT word at this point in our relationship. The term generativity was coined by psychoanalysts Eric and Joan Erickson, and the Ericksons were the first theorists to suggest that we keep developing until we die. Each one of their 8 stages of psychosocial development is described as a yin-yang, so generativity has an opposite, and it's called stagnation. Generativity takes place during middle adulthood, generally 40 to 65, and it's about giving back to society through doing or making things, being productive at work, becoming involved in community activities and organizations, or raising kids. Through generativity, we develop a sense of being part of the bigger picture. At the Alliance, our generativity sweet spot is tackling gaps in age-related health education and public policy, and we do that by connecting people, groups, and federal agencies to learn from each other and do good things together. There are many issues my exceptional Alliance colleagues took on this past year, and I want to call out just a few. We've had the privilege of working side by side with people who are living with Alzheimer's to advocate for Medicare coverage and access to FDA-approved treatments. These honorable individuals know their time is limited. They've spoken in real and raw ways from the heart about their personal experiences in meetings with CMS, HHS, and all the way to the White House. Unfortunately, Medicare's final coverage decision for an entire class of Alzheimer's treatments severely restricts patient access, and it sets a grave precedent for other serious and life-threatening conditions. This is unacceptable, and while we may have lost the battle, we plan to win the war. This past February, we observed the 6th anniversary of Heart Valve Disease Awareness Day, which takes place every year on February 22nd. In 2022, the Alliance partnered globally with 117 organizations, activating more than 2.3 million people to spread life-saving messages. That's actually folks who did stuff, not just impressions, about heart valve disease risk factors, symptoms, and the importance of early detection and intervention. In 2022, our Best Shot campaign is reminding older adults to get back on track with all CDC-recommended vaccines, including COVID-19 boosters. We've long advocated for CDC's advisory committee to preferentially recommend enhanced flu shots for older adults, and this year they finally did it. We have also continued co-convening the COVID-19 Vaccine Education and Equity Project with Healthy Women and the National Caucus and Council on Black Aging to cut through the noise and provide reliable, clear information on all COVID-19 vaccines and boosters. The Project Pause coalition that the Alliance convenes with the American Society of Consultant Pharmacists seeks to ensure patient-centered, appropriate care without stigma or barriers for people with neuropsychiatric symptoms of dementia who live in nursing homes and other long-term care settings. This year, we secured Senate Appropriations report language that asks CMS to design better quality measures to accurately capture clinically inappropriate use of antipsychotics in skilled nursing facilities. Additionally, the Alliance received a Gold Telly, which is the highest honor given, for its Shake the Stigma of Neuropsychiatric Symptoms educational video. And we are always into talking nerdy. NERDY stands for Nurturing Engagement in Research and Development with You. We now have more than 100 older adult patients and family caregivers in our Talk Nerdy to Me network who've gone through our training on how to use their personal experience to serve in public and private research advisory roles. It's evolved into a year-round program with continuing education. And the last effort I want to highlight is drug pricing. For the last few years, we have dug into the nitty-gritty on drug affordability through Project Loop. Despite our maybe getting a little sick of drug pricing last year, Congress finally passed several of the issues we advocated for, including expanding Medicare's low-income subsidy program, eliminating co-payments in Medicare and Medicaid for CDC-recommended vaccines, ensuring that drug price increases in the Medicare program do not rise above the rate of inflation, creating a flat copay for insulin at $35 a month, which we'd like to see expanded to other widely used medications, restructuring Part D benefit, and most notably, creating a $2,000 annual cap on Medicare Part D out-of-pocket expenses and giving beneficiaries the option to evenly spread their costs over the plan year. It's a huge victory. That was a big group effort, and we are proud to just be a part of it. While we are thrilled with all the policies I just mentioned, we oppose direct negotiation due to the likelihood that the Medicare program would set drug prices using cost-effectiveness measures that discriminate against older adults and people with disabilities. We've opposed this policy in all its iterations and under different administrations. It's always important to take a close look at not only the ends, but the means to ensure that our communities are not harmed along the way. We'll continue to work with the administration to deliver the message that access and equity in healthcare can't be buzzwords, but values that must be held to as the Inflation Reduction Act is implemented. You might wonder why we chose drug pricing and some of the other controversial issues we've recently engaged in. We don't seek out these challenges, and they are tricky, but we can't be afraid to advocate on issues that will matter to all of us as we age. I'm so proud of the individuals I get to work with every day and that tackle these issues with me. They are super smart, motivated, and kind, a true team of people that are essential to each other's success. All of what I just shared is from them and due to them, and I would like them to please stand and for you to please join me in acknowledging them. If I had to pick a top lesson we learned during this past year and throughout the pandemic, it's this. Our U.S. social structures do not currently support generativity or healthy aging, let alone joy. For example, and some of you who are in the FDA panel, this is going to sound a little familiar to you, the U.S. has been experiencing persistent decreases in life expectancy for more than 2 decades. Since COVID-19, our decreases in life expectancy have been far worse here than in other high-income countries. The problem with our decrease in our life expectancy is not that older people are not living to older ages. What it represents is increases in premature death among younger people, a lot of which is preventable. Our social and political contexts matter. U.S. life expectancy varies by more than 20 years across counties in the United States, with the least healthy counties experiencing life expectancy comparable to some of the poorest countries in the world. While vaccines are already preventing COVID-related mortality, there is no vaccine to prevent premature mortality associated with limited access to health care, policy failures to prevent gun-related deaths and maternal mortality, or social disparities that exacerbate cardiometabolic and psychosocial conditions such as heart disease, diabetes, obesity, Alzheimer's and other dementias, overdose, and suicides. It's no wonder that many people today don't feel capable of giving back to society and suffer the opposite of generativity, which is stagnation. With stagnation, people feel isolated, are mistrusting, and they experience despair. And we are at a tipping point where we need to decide how to approach communities that are stuck in stagnation, including communities of people we don't agree with. These past few years have exposed our nation falling apart in explicit ways that have been hard to witness and really tough to escape. Curiously enough, while it's hard to face, if we try to shield ourselves from the discomfort, we're going to suffer more. We think that by protecting ourselves from suffering, we're being kind to ourselves. The truth is, we only become more fearful, more hardened, and more alienated. We experience ourselves as being separate from the whole, and this separateness restricts us to our own personal hopes and fears and to our extremes, and leads us to only caring for the people nearest to us. Brokenheartedness is not something that we should try to escape from. When we don't close off, when we let our hearts break about our inability as a country to come together, we discover our kinship with each other. Allowing ourselves to be brokenhearted leads us to empathy, and empathy opens us up and leads to joy, and not shallow joy, but genuine joy, glad to be alive joy. The Dalai Lama describes two kinds of selfish people, the wise and the unwise. Unwise, selfish people only think of themselves, and the result is confusion and pain. Wise, selfish people know that the best thing they can do for themselves is to be there for others, and as a result, they experience joy. Working with older people and in healthy aging issues every day is what gives us joy. It also gives us a higher awareness of impermanence. It's the little secret we work diligently to keep from ourselves, though we know it's the truth. We tolerate the secret while still allowing ourselves joy that this moment is all there is. And right now, it's a pretty good one. On behalf of the Alliance for Aging Research, thank you again for being here. We're honored to have you join us, and I hope you enjoy the rest of tonight's program.
Well, thank you, Sue, for sharing the incredible work that the Alliance does. And as she said, there's one lesson that points out to her that she struck her, saying this is most important. And listening to all the initiatives and the accomplishments, it's clear to me, and I bet clear to everyone in this room, that if you have a cause that you're seeking to partner with a credible, influential, important, and someone who gets things done, I think right now I would always make sure that the Alliance for Aging Research is right by my side for that. So again, congratulations, Alliance. We're so grateful for what you do. So as we go through the course of the evening, there's going to be some confessions, and it depends on the amount of wine I have, which is over there. But I want you to know that I was asked to talk about the mission of this whole meeting. And I was struggling. I said, I'm never going to say generativity. And I knew that, so I let Sue grab that word and so, to do that. And now I'll be singing fluently with joy and health. So anyhow, Sue, congratulations, great accomplishments. I'm glad you shared that with us. So now we're going to start recognizing individuals through these special awards that have been created, and each one is a prestigious award that we're going to talk about. The first award presenter of the evening is our Alliance's good friend, Tom Spulek. He's chairman and president of the Claude Pepper Foundation, who is here to present the Claude Pepper Award for advancing healthy aging. Tom will tell us more about this important award, named for the Honorable Claude Pepper, who fought tirelessly in both the U.S. Senate and in the House of Representatives to help those in need, including our nation's elderly. In his day job, Tom is partner in the law firm of King and Spalding and chairs its government advocacy and public policy group in Washington, D.C. Tom also is an adjunct professor at the Florida State University College of Law, and before entering private practice, Tom served as staff director and general counsel of the House Committee on Rules, as well as general counsel in the U.S. House of Representatives. But I think of equal importance to that incredible professional career, and to no surprise, is his devotion to giving back and making a difference in serving. Tom devotes a considerable amount of time in the service of nonprofit organizations. In addition to serving as chairman and president of the Claude Pepper Foundation, he is also chairman of the Hospice Foundation of America and is a board member of the Close-Up Foundation. Tom and the Claude Pepper Foundation have been incredible friends to the Alliance, and we want to thank him sincerely for once again supporting this year's Claude Pepper's Award for Aging. Please join a big round of applause to welcome Tom to the podium.
Kevin, Sue said you were awesome. I say you're really awesome. It's great to be here again this evening and doing it in person. Before I begin, I do want to thank Sue for her leadership and everything that she does. And I also have to recognize my old friend and Dan Perry. Dan, who, as you know, is the founder of the organization. It's funny, I remember that when Dan first started this organization, after having just leaving Senator Alan Cranston, he came to me and asked if Claude Pepper would write a letter to try to raise some funds for the beginning of the organization. So that seems so long ago, Dan, and it's also wonderful that we're still together working for this great cause. So thank you. So on behalf of the Claude Pepper Foundation, it's my distinct pleasure and honor to introduce the recipient of this year's Claude Pepper Award for Advancing Healthy Aging. This award is given each year to honor a Democratic member of Congress who was leading the way for policies encouraging medical research, innovation, and care to benefit Americans as they grow older. Established by the Claude Pepper Foundation in conjunction with the Alliance, the award is named for the Honorable Claude Pepper, who fought tirelessly in both the U.S. Senate and House of Representatives to provide all Americans with adequate health care, educational opportunities, a decent standard of living, and fair and equal civil rights, all during his 50 years of public service. As chair of the House Select Committee, he sought to strengthen programs for older, adult, and disabled Americans, including Social Security, Medicare, and Medicaid. Through the Claude Pepper Foundation, the Claude Pepper Center, and its related policy arms at Florida State University, the Congressman's legacy lives on. We invite you to learn more about the Pepper Foundation by visiting thepepperfoundation.org. This year's recipient of the Claude Pepper Award is Congresswoman Nanette Diaz-Barragán. But there's more. As the youngest of 11 children raised by immigrant parents from Mexico, Congresswoman Barragán knows about the challenges that many low-income minority families face firsthand. Her father was a television repairman, and he instilled in her a strong work ethic and influenced her love for baseball, in particular, the Los Angeles Dodgers. Her mother cleaned homes, cared for others, and worked in factories to make ends meet. The Congresswoman learned from her parents the values of hard work and community. After she earned her undergraduate degree from UCLA and her Juris Doctorate from the USC Gould School of Law, she began her career in public service in the late 1990s, working in the Clinton White House and later the NAACP. The Congresswoman was the first woman in 12 years to be elected to the Hermosa Beach City Council, and then went on to be elected by her peers as the first ever Latina to serve as mayor. During her 2-year term on the City Council, she was a strong advocate for environmental justice. She successfully stood up to a powerful oil company and stopped a proposal to drill 34 oil and water injection wells in Hermosa Beach and out into the Santa Monica Bay. In 2016, she took her advocacy to the national level and was elected to the U.S. House of Representatives, becoming the first Latina to represent California's 44th Congressional District. The Congresswoman is vice chair of the Congressional Hispanic Caucus today, and in 2019, she became the first Latina in 10 years to hold a seat on the prestigious House Energy and Commerce Committee, and only the second Latina to ever do that. The Alliance for Aging Research and the Claude Pepper Foundation are very pleased to honor Representative Barragán for her tenacity and courage in standing up for older Americans. This year, she led 40 of her House colleagues on a bipartisan letter to Health and Human Services Secretary Becerra and CMS Administrator Brooks LaSure, urging them to provide broad Medicare coverage to FDA-approved therapies for people with Alzheimer's disease. The Congresswoman rose above one of the most politicized and contentious phrases in the history of Medicare, perhaps, to support patients and their families. Your courage was noticed, Congresswoman, and appreciated by all of us. The Congresswoman is a lead sponsor of the Equitable Community Access to Pharmacist Services Act. This legislation would allow pharmacists to continue providing vaccines after the public health emergency ends. In fact, pharmacists administered more COVID-19 vaccine doses than any other healthcare professional. So thank you for being a fierce advocate for older Americans and Americans from all backgrounds. You are truly a leading example of what Claude Pepper's legacy is all about. It's an honor to be with you and to present to you the Claude Pepper Award for Advancing Healthy Aging. So ladies and gentlemen, please welcome me and welcome Congressman Barragan to the stage.
Is this for me? No. I'm kidding. Well, thank you. Good evening to everybody. Thank you, Tom, for that wonderful introduction. Next time I'll make sure to edit it and cut it down a little for you all. It really is a pleasure to join you here tonight, the Alliance for Aging Research, and so many distinguished colleagues and guests this evening. It's my honor to stand here before you and to just look out across this room to see the people who are on the front lines, who are fighting for our older adults and who join in that fight, and those of you who are on the front lines. I may be in Congress, but you also do the work, whether it's helping to raise money, whether it's your advocacy. Thank you. I want to start by thanking the Claude Pepper Foundation. I am honored to receive this award. Claude Pepper was a pioneer in strengthening our nation's social safety net to ensure that those less fortunate and those that are aging have the resources needed to live with grace and dignity. To make a real impact in our respective communities, you have to be willing to stand up for what you know is right. It was my honor to raise my voice with backing from nearly 40 House colleagues to speak out about the need for Medicare to provide equitable access to FDA-approved drugs for the treatment of Alzheimer's disease. Let me tell you, when I first started to talk about the issue, I was asked not to. And I was told it was a politicized issue on the other side of the aisle. And Alzheimer's and the treatment and the cure is not a Republican issue or a Democratic issue. It's a healthcare issue that we all should be fighting for. It's also a very personal issue. My mother has Alzheimer's. She's 81 years old. She's had the disease for several years. And like many loved ones, I have served as a caregiver, a personal caregiver, whenever I'm not working. In January of this year, I had to move in with her because we were struggling to find caregivers that would consistently show up, that could speak Spanish, her first native language. And let me tell you, I get more sleep here in Washington than when I'm home these days because of the struggle. And so we continue that, and I just reach out to all the caregivers and family members. I know how hard it is, and I hear the stories that you tell me and what you went through, and that helps, gives me strength. So thank you for that. And it also helps motivate me and encourage me to say why this is such an important fight and why we must continue. Because for so many families, the stigma of Alzheimer's disease, the fear of what will happen next, and how they will manage the progression of the disease is an everyday concern. Nearly 6 million individuals have Alzheimer's, including 150,000 Angelenos. And as somebody who serves as the vice chair of the Congressional Hispanic Caucus, it is growing and growing and growing amongst the Latino community, where we just don't know what that means for our families and where we have many issues with caregiving. And many times it means somebody in the family is going to stop working to take care of a loved one. So when the FDA approved an innovative drug that showed promise to slow the progression of the disease, many families like mine were thrilled. We were so thrilled. It represented hope. The hope of more time with loved ones, Families were also excited that there were at least 3 other drugs that are in late-stage clinical trials. I remember talking to my mom's doctor about it. My mom was too far advanced. She doesn't know my name, although she knows I'm her daughter. And then came the gut punch when Medicare said they would not cover the drug, including for new drugs for which they haven't even seen data yet, and I was shocked. For me, this was an access issue. It was about making sure that everybody had access to the same drugs. And I thought, something's broken. How does the FDA approve something saying it's okay, but then CMS doesn't cover it? The decision meant that people with money could access these drugs, but those relying on Medicare to pay for their treatment cannot. This is not what justice and equity looks like. Now, despite CMS's decision, this fight isn't over. I will continue to push for additional investment in research and care, as well as for Medicare and Medicaid to provide equitable access to promising treatments for Alzheimer's disease. And I want to tell you that this House letter that had 40 of my colleagues on it, what was really remarkable about it was the spectrum of members that we got on it from across the political spectrum, which for me just reinforced this was not a political issue and that it touched lives across the board and that we had to continue the fight. We even got a meeting with the CMS administrator, who I will tell you for 30 minutes sat down with me on a Zoom to explain to me the decision for which I kept pushing back and challenging the decision and trying to poke holes in what I was told. And again, that fight will continue and it is not over. And people say, why do you care about this so much? Why are you continuing? And I remind people because it's the right thing to do and it is an equity issue that I'm going to fight for. So as Tom mentioned, I am honored to serve as the second Latina ever to serve on the Committee for Energy and Commerce. And I had a fight to be on the Healthcare Subcommittee because this is one of my top issues in making sure that we are fighting for access to healthcare. You know, I've been honored to introduce legislation like the Equitable Community Access to Pharmacist Services Act that would permanently remove barriers to ensure that our loved ones that are living in nursing homes can be vaccinated against COVID, pneumonia, flu, strep, and others. We're also working to provide funding to programs and coordination efforts to address social determinants of health by continuing to push and support legislation like the Improving Social Determinants of Health Act, which would make sustained investments to address the societal and environmental factors that influence our health. I want to close by sharing that I have real hope for moving these and many other important reforms for patients forward. I am encouraged that just last month we were able to address some of the major financial barriers to healthcare by passing an annual Medicare $2,000 out-of-pocket limit for prescription drugs, as Sue mentioned, and eliminating vaccine co-payments for those on Medicare and Medicaid. There is a lot of work to do. And while you may read the headlines that Congress is divided and it's very political, there is work being done behind the scenes. And I'm proud to say that I reach across the aisle often to make sure that we try to do this in a bipartisan way, because that is the way healthcare should be done, especially when it's those affecting our older adults. So I want to thank you again to the Claude Pepper Foundation, to Tom Spulak and the Alliance for Aging Research for this award. As Senator Pepper said, and I quote, "What worthier purpose could government serve than to make life a bit happier and a lot less arduous for its people? A nation is stronger and better in every way if it concerns itself with the health, the education, the housing, and the economic security of its citizens." I will continue to fight for older adults, and I look forward to working with everyone in this room to make meaningful change possible. Thank you again. Who's taking it? Oh, do we really want that in it? Maybe we should go on this side.
Yeah. I'll take that down. much.
Well, congratulations, Congressman Barragan, for the Claude Pepper Award, and more importantly, for sharing your personal story that motivates you. And I have always been, the Alliance has always been a firm believer, fighting for healthcare, fighting for healthy aging doesn't have a political name to it. It's doing the right thing. And so bringing that forward and sharing how it impacted you personally really was moving. And so we thank you, and you were the perfect recipient of the Claude Pepper Award. So our next presenter is the founder of the Alliance for Aging Research, my dear close friend. I wanted to know that Tom said my old friend, my close friend, Dan Perry. So who is Dan Perry? Well, Dan knew many, many years ago that there's a great need to shine a spotlight and encourage research on aging. And because of that, he formed the Alliance in 1986. And soon, the Alliance for Aging Research, over the course of those many years, became a leading, credible voice on the fight for aging. We needed more research. People needed to understand how important this is as our society started getting older, that we needed to pay more and more attention to this. So he developed a broad agenda on the medical and scientific research that was required to do that. But then in 2015, Dan retired. And no different than Tom Brady, he came right back. We said, it's over. And Dan goes, well, you could use me in other capacities. So we had Dan right away join the Alliance, and he became a member right after his retirement, and we were so fortunate to have him join the Alliance. He now serves on the board and is also as a member of the founder. But we wanted to recognize, for someone who had the foresight, the power, the tenacity, way before it was in vogue to be involved with the aging, we said there should be an award in recognition of Daniel's honor. And so I will tell you this, I have always been proud to have worked with Dan on the board, to know him as a friend, to see his passion. And so we're gonna bring him up here so he can present the prestigious award, the Daniel Perry Award, to our good friend, Dr. Gary Puckrin. Dan?
Since joy is one of the themes of tonight, it gives me great joy to see Kevin Rigby back on this podium and all of you together, real people here in this room for this celebration. And Tom Spulak, my recollection of that first meeting was that I was asking for Claude Pepper to be associated with the Alliance for Aging Research and be part of our Congressional Advisory Board. Can you imagine such a thing now? The Ethics Committee would never allow Congressional Advisory Boards. But we had one then, briefly, and the idea of having an organization that was speaking up for research to make aging better and for the betterment of people as they grow older. If you didn't have Claude Pepper, you didn't have anything. So, and Tom came through, and so did Congressman Claude Pepper. So thank you, Kevin, and thank you, Tom. You know, it's especially appropriate that tonight I have the honor to present the Alliance for Aging Research Founders Award to another founder, Dr. Gary Puckrin. It was through Gary's direct efforts and his continued leadership and as president and CEO of the National Minority Quality Forum that we have that organization now embedded in our health policy community. And it's a benefit and an enrichment to all of us that we have it. Much has been said about in national policy circles about health disparities, inequalities that shortchange Americans in communities of color to access to good health at every age, including healthy aging. But for over a quarter of a century, Gary Puckrin and the National Minority Quality Forum have brought that issue home to members of Congress, to their staffs, to policymakers at every level. It was a brilliant strategy of Dr. Puckrin and his group to localize data down to the zip code level on the disease burden of communities of color. Their zip code analysis project and health assessment tool show legislators exactly how policy choices that they make will impact the health outcomes of their members, of their constituents. For the past 20 years, under the auspices of Dr. Puckrin and the NMQF, 1,000+ healthcare leaders every year have gathered to review the latest research on quality care delivery for diverse populations. More recently, Gary and the NMQF created the National Alliance for Brain Health and Awareness to improve quality and equity in the diagnosis and treatment of behavioral health and brain health conditions. This initiative pinpoints gaps in research and in diagnosis and treatment for underserved patients and families struggling with neuropsychiatric ailments. These include everything from depression to agitation, aggression, and psychosis. Such issues are especially common among people and families coping with Alzheimer's disease and other dementias, causing functional impairment, poorer quality of life, more rapid disease progression, and even death. Just last month, the Center for Medicare and Medicaid Services issued an enhanced ICD-10 coding for dementia, for neuropsychiatric symptoms of dementia and stages of severity of Alzheimer's disease. This goes into effect October 1, and it sets the stage for more precise clinical research and better care for people living with Alzheimer's and other dementias and their related neuropsychiatric symptoms. This major step forward was led by the National Minority Quality Forum and of their National Alliance for Brain Health and Awareness. Gary and the NMQF also conduct a Medicare claims data analysis for Project PAUSE, a coalition convened by the Alliance for Aging Research and the American Society for Consultant Pharmacists. We're pleased that the NMQF is a member of Project PAUSE Coalition, seeking to ensure that all individuals with neuropsychiatric symptoms in long-term care settings receive high-quality, patient-centered, appropriate care and treatment. NMQF's analysis will surely help to shed light on inadequate nursing home quality measures that need to be fixed. So, for all he has achieved, for his fellow Americans through the National Minority Quality Forum, I am proud to present the Alliance for Aging Research 2022 Founders Award to my esteemed colleague and longtime friend, Dr. Gary Puckrin. Please join me in welcoming him. Gary?
So thank you so much, Dan. He may not know, but when I first got started with NMQF, Dan was one of the folks that we looked up to. And it's such an impossible honor to receive this award in his name tonight. It's part of a journey that one can hardly describe. So thank you so much. And I want to thank Sue Peshkins and the Alliance for Aging. And before I go any further, I want to thank my wife, who puts up with me every day. I also, accept this honor really on behalf of the staff of NMQF. I don't actually do this. I keep telling people that I actually don't do it. It is my staff that did it. And Gretchen Wortman, for example, was the one who worked on the ICD-10 code and did the work. So in accepting this award, I was thinking about what I should say. And for those who have been around me long enough will hear me reel about financial risk and patient risk and why we need to reorient this healthcare system, because all it does is think about money and it's lost sight of the patients. But I figured a lot of you have heard that from me before. And so I thought maybe I would be vulnerable this evening in front of you and take you a little bit deeper into where I am going and where NMQF is seeking. And I'm going to do that by channeling a couple of physicists, Enrique Fermier, Richard Feynman, Michio Kaku, Stephen Hawking, the astronomer Carl Sagan, and the industrialist Jeff Bezos. And what they say, if you listen very carefully between the lines, is that as we look out into the universe, the only sentient life that we know of is humans on planet Earth. We can look deep into the Milky Way, and we can barely find life, let alone something thinking out there. The James Webb Telescope may help us, but what they also say is we are exceptional. We are the most exceptional thing in the universe. Think about that. I drive down I Street and 15th and look at those tent cities, and I realize those are incredibly exceptional people in the universe, right? And we treat life with such flagrant disregard, right? And if we disappear, life in the universe, sentient life is gone. We have such a higher mission, and all we want to do is talk about money. I'm profoundly confused. We have a purpose. Our purpose is to conserve life. That's the point of the exercise every day. So when I talk to you about patient risk and say to you, well, we want to keep them out of the hospital, we want to keep them out of the emergency room, we want to avoid disability, what I'm also saying to you is we have the capacity, the capabilities to control health outcomes. We do. Any day we wake up in the morning and decide that that's where we're going, that's where we're going. So it isn't just about equity in the narrow sense of racial populations who have been really profoundly treated badly. This is about the collective. This is about the common purpose. And I must confess, befuddled. I sit in a room, and to be honest with you, and I'm going to stop. I was sitting in the room today, we got some data in, and one of the people who was presenting the data was showing a chart that said, here is the physician who pays the less for diabetes. And I'm sitting there going to myself, but did they die? I mean, yeah, they paid less for it, but what the hell does that have to do with anything? We have to reimagine what we're doing. We have to mature. We have to awaken to our purpose. We have the capabilities to change the world, and we're not doing it, and I don't fundamentally understand. I listen to the debate in Capitol Hill, I don't even know what they're talking about. They're not even asking the right questions. They're not even thinking about the right question. So I decided that I was going to use this opportunity to be incredibly vulnerable to you, to send you home and say, are you doing the right thing? When you talk about value assessments and payment reforms and ICER and CBO scoring, is that the right conversation? Is that what you want to do with your family? So I've given you my vulnerability. I've told you what I get up in the morning and think about. What I get up in the morning and think about is the next generation, because I don't want them to have diabetes. I don't want them to die of cancer. I don't want them to have to deal with cardiovascular disease, and I think we're smart enough to do it. Thank you.
Fantastic, my friend. Fantastic. How eloquent.
Here, I'll stand to the side.
Really? Well, he's the award winner.
Oh, yeah, you get him in the middle. You get in the middle. Here, let's go over to the side so we can get over. This way, a little more. Thank you.
Thank you.
Thank you. So careful. You okay? That was so good.
Well, thank you, Dr. Gary Puckrin. And as always, Dan Perry, such a quality and longtime friend, he said, now follow that, Kevin. That's not nice. So listen, where we are, we're at dinner time. So dinner's going to be served. Please enjoy the dinner. As you saw, this great Chardonnay being served. We're going to come back at 8:15. So for those that are watching, please, I said we're going to show behind you some items that you can watch on TV, but we will come back on 8:15 and continue with the program. We have even more dynamic and important speakers to share. So enjoy the dinner, and we'll see you shortly.
The last few years, so we haven't been able to hold this important event in person since 2019. This event includes our 29th annual Bipartisan Congressional Awards dinner, which brings together honorees that have done amazing things for folks as they get older, as well as bringing together all of our supporters and friends. And I'm just so excited that we could be back together this year.
I love being able to empower people to take charge of their health and to get the resources and care that they need. I get to create resources that can help people as they face new diagnoses and new health challenges. And having watched many people I love navigate through their care, I know how important it is. Plus, we're all aging, so what we do is relevant to everyone.
I'm passionate about working on aging issues because if we're blessed to get there, it's something that's going to happen to all of us. And I think we can all relate to having older parents and grandparents age, and watching them age with dignity and health is something that I think we can all agree is very important.
I've had a long, varied experience with being interested in advocacy within the aging population. I worked for several local dementia programs as support staff, as a volunteer to give people time away, caregivers time away. I think aging is a really important process that we hope we all get the opportunity to do. The over 65 population is often one that is overlooked and minimized in the United States, and I think it's really important that we, as we age and as we have greater numbers of people aging within the United States, that we think about the best ways to improve quality of life for that population. So I'm very excited about that.
The topic of growing older can be a bit like some of the other big philosophical questions about life, where the majority of people don't really want to think about it until it's directly impacting them, or are even in denial they are growing older when, in fact, they are. However, if we are all fortunate, we will all live to experience the fullness of being able to look back on a life that is already full of meaning, but where we still have the ability and the time to contribute to our families and to our communities. I love being able to work on policy issues that help ensure people are healthy and able to make a difference as they grow older, both for the current generation and, God willing, for myself and my family in years to come.
I'm Jim Scott, Chair of the Alliance for Aging Research's Board of Directors. I'd like to thank Kevin Rigby for his excellent performance as an MC. I really feel like Kevin's the greatest MC ever and a great person too. And then I'd also like to thank Sue and the staff of the Alliance for their hard work and for Sue's leadership. This is really something that we're all able to be back together. So it's my pleasure to welcome you to celebrate our 2022 Heroes in Health. The tenacity, vision, and sheer courage of this year's award recipients are inspirations in every facet of our work. We are honored to consider them partners in helping people live longer, happier, more productive lives. Please join me in congratulating them. Tonight's celebration would not be possible without the hard work and commitment of our 2022 Heroes in Health Event Planning Committee. Their enthusiasm and creativity are reflected in what you will see today. Thank you to this year's committee members for giving us their time, strategizing on awardees and program, and helping us reach the record-breaking goal. But our work is not done. We must continue to not only reach our goal, but surpass it in these challenging times. Thank you to my colleagues on the Alliance's Board of Directors. Each board member has made significant contributions to helping the Alliance with its mission. They're equally invested in making sure older Americans receive access to the care and treatments necessary to live long-lasting, healthy, and rewarding lives. The generous corporate, organization, and individual contributions received at our annual Heroes in Health celebrations have allowed Sue and her team to be out front on Medicare affordability issues and coverage for FDA-approved treatments, heart valve disease awareness, older adult CDC-recommended vaccines and COVID boosters, our Talk Nerdy to Me program, and other initiatives the Alliance has worked on over the past year that we highlighted earlier in our program. Your being with us, whether in person or virtual, tonight to celebrate inspires us to keep moving forward every day to ensure that the experience of healthy aging in this country is one of progress, dignity, and kindness. We hope our work inspires you to connect with us at an individual level of support. If you'd like to do so, for those here with us tonight, please go to the iPads on your table and click Heroes to 132-560-33395. You will then receive a text, we'll then text you back with a link to complete your donation. Thank you. Congratulations again to the honorees and to Sue and the entire Alliance team for such an extraordinary event and year. Thank you all.
Well, that was definitely the best E.F. Hutton moment. It's time you can donate. We'll come back to that. Jim, I want to thank you for your comments. 6 years, he's been the leader of the Alliance for Aging Research, and I've had the pleasure prior to that serving on the board with Jim for the Alliance for Aging Research. And one thing you know about Jim, he's passionate and he's smart, and he knows how to put things together for the Alliance. So Jim, for your leadership, we want to thank you. Let's give Jim a round of applause as the head of the Alliance. So our next presenter is Deshawn Dorsey. DeShawn is the Executive Director of AdvaMed Excel, a division within the Advanced Medical Technology Association, which most people know as AdvaMed. She also leads the organization's work around racial health disparities. Prior to assuming her current role, DeShawn was Vice President in the Payment and Healthcare Delivery Department at AdvaMed. Prior to joining AdvaMed, DeShawn was the Director of Health Policy for the American Academy of Ophthalmology. And before that, she was a Senior Counsel with the U.S. Department of Health and Human Services, Office of Counsel to the Inspector General, where she worked as a litigator on a variety of fraud and abuse issues. The Alliance is truly grateful to AdvaMed for its support of the Silver Innovator Award. Please join me in welcoming DeShawn as she honors the groundbreaking work of Dr. Ruth Westmeyer for our 2022 Silver Innovator Award honoree.
Good evening, and thank you so much, Kevin. The Silver Innovator Award recognizes an outstanding individual who has furthered research and innovation in healthy aging. I am honored to present the Alliance for Aging Research's 2022 Silver Innovator Award to sex therapist Dr. Ruth Westheimer, better known as Dr. Ruth. As most who lived through the 80s, like me, know, Dr. Ruth rarely turns down an opportunity to speak about sex. And she continues to dispense frank advice, as she has since her first radio show, Sexually Speaking, in 1980. Unfortunately, Dr. Ruth had a minor medical procedure come up last week. Thankfully, she is well, and we were invited up to her home in New York in late October to tape an interview with her. The Alliance will send the video to everyone with their save the date for 2023, so please be on the lookout for it then. In the meantime, I wanted to share a few words about why we are honoring Dr. Ruth this year. At the age of 94, Dr. Ruth's birthday wish this year was to help lonely older people. She asked the state of New York to make her the ambassador for the War on Loneliness, stating, "The loneliness of the pandemic is something that is going to be with us for a long time. I want to give some good advice for those people who, even after the pandemic, will still have issues with relationships and issues of loneliness." Over the pandemic, she has continued her online presence, emphasizing staying positive and how to stay safely connected with loved ones during the COVID-19 pandemic. Dr. Ruth has also maintained a storied allyship with women, having open conversations about sexual health in all romantic and sexual orientations and age ranges. This is exemplified through her authorship of 45 books on sex and sexuality, and specifically this year's launch of the revised edition of The Art of Arousal. For more than 40 years, Dr. Ruth has been dedicated to demystifying sexual health and intimacy by providing serious, yet candid, funny, and respectful advice on how to get some. In 2023, the Alliance will be taking on the issue of sex and intimacy as people age, exploring policy and health education gaps with healthy women and other valued partners. Because, as Dr. Ruth tells us, when it comes to sex, the most important 6 inches are the one between the ears. Thank you.
I know nothing. Well, congratulations to Dr. Ruth, her wisdom, her comments. There's an HR room for you. So that being said, we have our next presenter, Michelle Kimbrough, who serves as the Senior Director of Federal Advocacy for Eli Lilly and Company. Michelle works to establish and maintain Lilly's relationships with national organizations serving communities of color, as well as patient advocacy and health professional organizations in a variety of therapeutic areas. By identifying areas of mutual interest, Michelle aims to create partnerships that truly improve patient care. Prior to joining Lilly, Michelle worked in the nonprofit sector for over 10 years with an emphasis in mental health. She has worked with children, adolescents, and adults in a variety of inpatient, outpatient, and community-based settings. Michelle serves on the board of directors of the Greater Washington Urban League and the Choices Coordinated Care Solutions, which is a nationally recognized system of care for programs for youth. Lilly is generously supporting this year's Distinguished Public Service Award. So let's bring a big round of applause for Michelle and bring her up here to announce the award.
Good evening, everyone. I feel like the evening's getting harder. First, we have to follow Gary, and now Dr. Ruth. So I'm happy to be here on behalf of Eli Lilly and Company to present the 2022 Alliance for Aging Research Distinguished Public Service Award, given each year to a Republican member of Congress who is leading the way on policies encouraging medical research, innovation, and care to benefit Americans as they grow older. This year's award honors Senator Tim Scott. Senator Scott has served the state of South Carolina in the U.S. Senate since 2013. Growing up poor in a single-parent household in North Charleston, South Carolina, Tim watched his single mother work 16-hour days as a nurse's assistant to keep him and his brother afloat. Caregiving, as you all know, in a nursing home is back-breaking work. And Tim has said that had it not been for his mother's sacrifice and perseverance, he would not be where he is today. Senator Scott recognized that our nation's long-term care system was facing a dire workforce shortage that only intensified in the wake of COVID-19. With his colleague, Senator Warner, he introduced the Ensuring Seniors Access to Quality Care Act to stop the cycle of financial penalties and resulting reduced ability for nursing homes to train and retain staff. CNAs provide essential care in nursing homes nationwide, and we need strong training programs to ensure that older adults can access 24-hour care. Without workers, there is no care, which is why we need to pull every possible lever to build the direct care workforce. It must be pulled in any way possible. Senator Scott's work to advance better quality care and access for older adults extends to telehealth. Last year, he introduced the Telehealth Modernization Act with Senator Schatz and a bipartisan group, including Senator Collins and Warnock, to make telehealth flexibilities that were enacted during the COVID-19 public health emergency permanent. For the tens of millions of Medicare beneficiaries and others who have come to rely on telehealth services, this legislation is invaluable. Lastly, this honor is to recognize Senator Scott's advocacy for diversity in clinical trials, something very important to Eli Lilly and Company, and I know many of you here in the room tonight. The Diverse Trials Act, which Senator Scott introduced with Senator Menendez, will make it easier to conduct trials that reach into underserved communities, support outreach efforts for conditions that disproportionately affect communities of color, and create flexibilities to help overcome transportation barriers and the financial burden of missed workdays that we know too often serve as barriers for participation. Senator Scott could not be here with us tonight. However, he sent the Alliance a message of thanks for the 2022 Distinguished Public Service Award. So we'll show you the video now. Thank you.
Hey, y'all. It is certainly an honor to receive the 2022 Distinguished Public Servant Award. Your efforts are more important now than ever before. In just a few short years, seniors will outnumber children for the very first time in our nation's history. My home state has one of the fastest growing senior populations in all of the country. As ranking member of the Aging Committee, I've introduced bipartisan legislation like the Ensuring Seniors Access to Quality Care Act to help nursing homes train and, of course, retain staff. The Telehealth Modernization Act. This is to expand telehealth and make it permanent, helping seniors and rural Americans have access to quality health care. The Diverse Trials Act to improve access to clinical trial drugs and bridge the racial disparity gap. Thank you so much once again to every single person at the Alliance for this honor. Keep up your really good work, and may the good Lord continue to bless all of us as we age.
Well, congratulations, Senator Scott. And so now it's my pleasure to welcome Andrea Michelli to the stage. Andrea leads the global policy team of policy experts at Johnson & Johnson as the Vice President of Global Policy. I understand that position. It is complex, the issues are many and incredibly diverse, and they're constantly coming at you. Her leadership has really mattered for Johnson & Johnson, but perhaps more importantly, for all the patients that Johnson & Johnson serves. She's really, I would encourage you to read her bio because it's significant and impressive. But you can see that, but she's also, which we really appreciate, she's a valuable member of the Alliance for Aging Research serving on the board. So it's wonderful that she's accepted to come forward to represent Johnson and presenting this year's Perennial Hero Award. Let's give her a big round of applause.
Thank you, Kevin, and hello, everyone. I'm really thrilled to be here tonight to help present this year's Perennial Hero Award to one of my mentors, Dr. Janet Woodcock. The Perennial Hero Award honors a well-established statesperson who continues to leverage their expertise to create positive societal change and who serves as a role model for people of all ages. The term perennial in this context was coined by Dr. Laura Carstensen, founding director of the Stanford Center on Longevity. She wrote that the symbolism it connotes is perfect. For one, perennials make clear that we're still here, blossoming again and again. It also suggests a new model of life in which people engage and make new starts repeatedly. It is aspirational. The Alliance is honoring Dr. Woodcock with this award to recognize her inspiring career as the national leader and as a public health servant, a longstanding public health servant. We're especially excited to honor her tonight in her 38 years of service at the Food and Drug Administration, where her thoughtful leadership has led to so many transformations, widespread use of innovative new tools and technologies and approaches, availability of transformational breakthroughs in so many therapeutic areas, including COVID-19 therapeutics, important drug safety management processes that impact us every day related to the drugs we take and our families take. She's also led where her expertise was needed most during the COVID-19 pandemic, whether it was at HHS to help coordinate efforts there with drug development and regulatory review related to COVID-19 products, or moving back to the FDA to serve as acting commissioner during that very critical time. She's not only respected, but I know she's beloved by professionals at FDA, with stakeholders in the community, and of course with alumni like myself from FDA. She's appreciated for her willingness to cultivate and support growth for those early in career, and her general reverence for and real true interest in the patient and family caregiver experience has led to so many transformations at FDA related to engagement and involvement of those communities in drug development and in review. Joining me for this very special presentation is FDA Commissioner Dr. Robert Califf. Dr. Califf was confirmed earlier this year as the 25th Food and Drug Administration Commissioner, but it's not his first time. He previously served as Commissioner in 2016. Before that, Dr. Califf served a stint as the FDA's Deputy Commissioner for Medical Products and Tobacco. He has a distinguished career. I could spend quite a long time talking just about Dr. Califf, but he's known as a public servant, a physician, a researcher, a leader in the fields of science and medicine, in particular cardiovascular medicine, healthcare quality, and translational research. So in addition to his position currently at the helm of the FDA, Dr. Califf also has been head of medical strategy and senior advisor at Alphabet, and as professor of medicine and vice chancellor for clinical and translational research at Duke University. Please join me, Dr. Califf, for this presentation.
Well, it's really great to be here tonight to honor Janet. And let me just, a few words of introduction. I'm actually a recipient of the longevity of Janet's service at the FDA. Early in my career, I was avidly working on figuring out what to do about heart attacks. And I remember I was sitting there in my office one day trying to figure out what all these federal regulations were about how to fill out all of these damn forms that had to be filled out. And I got a call. It was Dr. Woodcock instructing me about what I was supposed to be doing. This was several decades ago, to say the least. So I had some prepared remarks. The FDA staff is really great at producing prepared remarks, but it's been a long day. I've just been over at the Sammy Awards, by the way, which is really a remarkable thing for those of you who haven't been there. The federal service, the winner, by the way, was the gentleman who oversaw the new telescope, which many of you have wondered about. It was just an amazing story to hear about his career, but I think Janet's clearly rivals that. So needless to say, when I got the call asking, would you be willing to come back as commissioner, I sort of had two questions. Are you going to let me do my job was question number one. Question number two is, what does Janet think? Because there's no way I would have come back had Janet not been willing to stay in there and do what she's doing. And she's been a tremendous, tireless asset to the entire FDA as I've tried to get back into the saddle, and I really appreciate it. So 6 words, I like to describe people with words. 6 words about Janet, see if these ring true. Number 1 is knowledge. She knows everything there is to know about the FDA, where all the bodies are buried, where all the misdeeds have been done, and where all the good things have been done. But she also has an encyclopedic knowledge of medicine, but beyond medicine, structural biology and chemistry, which comes in handy, believe it or not, almost every day in the work we do at FDA. Number 2 is honesty. Whether you like it or not, Janet is going to tell you what she thinks. I've never in my time at FDA or outside of FDA had to wonder, what does Janet believe? What does she think is right? She tells the truth. Even under withering criticism from Congress people, she tells them the truth. And it's something that's greatly admired both inside the FDA and outside. Related to that is number 3, which is courage. It is easy to fall into line when you're in federal service with the whims and political changes and what people want to hear. She's had the courage to stand up for the truth. Number 4 is caring, and I would argue that Janet's caring comes out in ways that you all know. Patient groups know that she has stood for you throughout, when they're good things for you, but also when they're not good things for you. She's been honest about that. It's not fake caring, which I think is rampant in our society today. I'm constantly told by communications people, not my communications people, of course, they would never do this, but to talk as if I really care about something, to project it that way, as opposed to actually having it happen naturally, and it does with Janet. Number 5 is wisdom. You know, it's one thing to be knowledgeable, it's another thing to be wise, to see beyond the knowledge into what the implications are going to be. One of the things she told me in 2015, I'll never forget, she said, be careful what you write or advise people to put in regulation, because one sentence from FDA creates an entire industry, or in converse could destroy an entire industry. That's wisdom. And then the last is resiliency. To see the kinds of things that Janet has put up with over the years and still come back to fight. And I think you feel the same way when you, why is Janet so admired? I think the number one thing is this ability to keep bouncing back and keep after the mission of the well-being of the American people, which is something we always know is her primary North Star. So thanks and congratulations, Janet.
Well, I'm going to make this very short because we've had some extremely eloquent recipients, and I'm really humbled to be in their company. We have seen people who've dedicated their lives to lifting up others and helping others. And I will say, you know, I've spent my entire career trying to help people be well and thrive. And that really is why I have persevered and why I think I'm resilient, because that is the objective. And as I've been here tonight and I've talked to so many people, I've worked with on projects, with Dan, with Gary, with Ann Barker there, with so many people, with Rob, and we have really made a difference over the years. And I just heard about another project we work on where we've had 15 trials of Alzheimer's done, including a large representation from people who usually aren't included in trials. So I think by persevering and by working together, we can make a difference. And you know, I see that difference every day as I work. It isn't fast, and it isn't very immediately satisfying. In fact, it's very frustrating, right? But it is probably the most rewarding thing that a person can be engaged in. And I'm really privileged. I thank everyone for the recognition. I thank the Alliance, who've been great partners over the years. I've loved working with Sue, and we have more work to do. That's really where I'm focused, is getting those things done that will help the people in this country thrive and help us all do better. So thank you very much, and thanks for the award.
Dr. Kayla?
Oh, thank you. Great yourself. You're so tall. That picture this morning, people are too tall.
I'm too old to bend down like that.
Thank you.
Well, it's a great way as we start coming to close the night. Dr. Califf truly is going from two events. He did one and came back here after he went through that. So thank you for being here. Thank you for being the FDA commissioner again. And for Janet Woodcock, a legend, for all the things you've worked on, for all the patients you've helped, for all the work you've done partnering here. We were forever indebted, and we look forward to continuing that kind of dialogue forward. So thank you and congratulations. So we're coming to the close of the evening, and again, as we started, we want to start by saying thanks. And sometimes we don't do that enough, but we really appreciate. This was a record turnout, a record amount of funds that have been generated, over $620,000. And it really is phenomenal, so congratulations for the clapping. In my talking points to those, if you want to give a little more, feel free. But that being said, the first thing we want to say is you heard some of the most impressive awardees that come up here to ever be on this stage. The speeches only are the top of what their passion is about patients. Every day they get up trying to make a difference to make someone's lives better. And it's really just so powerful and energizing. When we leave here every year, you say to yourselves, now I get it, it energizes me, we need to do more. It's great to hear it is not about politics. It is not about who's wrong or right or putting people in corners. It's how do we collectively, together as a partnership, get to the next level so that people's and their suffering starts ending. As really Gary said so poignantly, who doesn't want to see the end of cancer or diabetes or high blood pressure? We need to be fighting that each and every day and doing the discoveries and the innovation that requires it, and not having really issues that prevent people from whatever your race, religion, or your financial need is, that you can have access to that kind of medicine. But we need to persevere, and each one of you are making that kind of difference. So in the very beginning, I think all the awardees who received those special awards here, would you stand up one more time for a round of applause? To the Alliance for Aging Research team, would you please stand up, who makes this happen throughout the year? And let's keep Sue Peshin up one more time, because she's the engine that makes that happen. It is unbelievable. So I hope you enjoyed tonight. It is wonderful to be together. Big group hug. I've heard things that I'm going to have to go to the HR room, but I feel okay. It wasn't me. I look forward. Next year, we're going to do bigger, more, and better. Have a great night. We have incredible desserts up there. Really, so enjoy the night. We promised 9 o'clock. We hit it. So have a wonderful evening. Thank you so much.